So here we have a before and after case of a situation that included a lateral incisor that was in crossbite. And so basically, I want you to look at the length of the clinical crown in the finished position. This is the finished result, and in the beginning. And you notice the difference in the height of the tooth. So basically, the ClinCheck involved a buccal movement of that tooth. But what you really will see with aligner treatment, kind of like a round wire, you'll see a tipping, which will lead on that fulcrum to a lifting of the incisal edge, a raising of the gingival margin. And that is not accounted for in this ClinCheck. This ClinCheck was ambitious, especially without an attachment, to try to bring that tooth out and then give it some vertical overlap or some overjet to stabilize it. But that didn't happen. What happened is the aligner was shaped exactly like you see here at stage 33, but the tooth inside that was shorter than the mark. Now, you can focus on some sort of refinement or techniques to bring the tooth down, but at the end of the day, this plan actually probably wasn't ideal because the patient has a high lip line and you can see the gingival architecture has a step. The problem here is the shortness of the clinical crown. So again, what I did chair side, and you can do this at the end of all the aligners before maybe a retainer, or if you're going to do refinement, or you can do this midway if you want to improve tracking of the remaining aligners, is I basically took the tray, which was demarcated here, the incisal edge of the tooth was here. And so I prepped and beveled the tooth, filled the tray with bonding material, usually an A2 shade is a good universal, and then cured it, peeled it off, cleaned off the excess, and here's the tooth after the bonding. And then basically you then can even have the patient leave this in place at the end of the treatment, tell them maybe to get it switched out by their general dentist if it's not perfect. But this is a great technique, not just to finish up an aligner treatment, but to lengthen a worn tooth to help you have an extension to give you a better mechanical fulcrum to continue the remaining movements.